Hi, I'm Dr. William Wiley. I work in Cleveland, Ohio. I'm a cataract refractive surgeon with Cleveland Eye Clinic, and I specialize in doing cataract and refractive surgery, a lot of premium cataract surgery, and that's where I think Cassini has really helped up my game. And I'll go over some of the things that I like about Cassini and what makes it unique and special for our practice. Cassini's been a great tool, in particular for measuring anterior and posterior corneal astigmatism, so you can get total corneal astigmatism that can help guide me for toric IOLs for premium patients. Traditional techniques have a tough time measuring the total corneal astigmatism. We have tools that might measure the anterior pretty well, also have tools that can measure intraoperative astigmatism. That's great, but can be sometimes hard to manage because of variables. And what's great about Cassini is it gives you a preoperative diagnostic that can measure anterior and posterior corneal astigmatism, so you get that total corneal astigmatism that gives you the true value of what you're looking for when placing toric IOL. One of my favorite features about the Cassini guidance system is, number one, it takes a great preoperative image that gives you the full corneal power, and then you can translate that to the operating room, and it can give you an overlay, a visual overlay on the eye to tell you exactly where that astigmatism is. So when I'm placing a toric lens, I want to make sure I'm exactly in that right spot. And we also use things like intraoperative aberrometry to help guide that, but now I have some redundancy. I have both preoperative measurements and intraoperative measurements that give me that intraoperative guidance to make sure I've got that toric lens in the exact right spot. So, when using premium lenses, you really want to make sure you hit that target. Patients have a high expectation that they're going to get the best possible visual outcome. And we've done a great job as an industry measuring, a sphere for IOL. So we do a really good job of hitting the sphere target. Sometimes we struggle with hitting astigmatism because it's hard to determine, the anterior and posterior corneal astigmatism and the true corneal power. So it's hard to make sure you've got the right toric power and the right alignment. What Cassini can do is give you confidence that you're going to have the right lens for that patient to make sure you're delivering that outcome out of the box that they're looking for.